So I have really enjoyed all the speakers this morning and learned quite a bit. And what I would like to do is to share with you some of the information that have been found specifically about sexual violence, working directly with young people, either in schools or in clinics, through survey, direct questioning, or using psychometrically tested measures. So as you know, I work at the Mount Sinai Adolescent Health Center, and some of what I'm going to share with you is from there. But I would like to start just with what Dr. Witham mentioned, that the states actually voluntarily report data of abuse to the federal government, and that the majorities neglect, about 70%, about, I would say 18% or so is physical abuse, and about 8% is sexual abuse. In 2015, which is the latest data available, after they went and investigated and all that, they found that approximately 60% of children had this history of childhood sexual abuse. And we know that this is an underrepresentation because most sexual abuse never get reported. This is some research or analysis that I did using data from the Commonwealth Fund. This is data, but I'm showing it to you because I will show you the progression and the numbers. And the Commonwealth Fund did a survey in schools. This is a nationally represented sample of young people in grade 5th through 12th. And they asked the question in this survey, have you ever been sexually abused? And the young people reported about 10% of them said they had been. To me, this is also an underreporting because this question, to me, is not enough to really get to the history of childhood sexual abuse, but we saw this. Then what I did was also based on data that they had collected, I compared the young people that said they had been sexually abused with those that didn't report abuse, physical or sexual, which were the two things that were asked. And the young people, compared to the one that said they had not been physically or sexually abused, those that had been sexually abused were more likely to consider their health fair or poor, to have moderate or high depressive symptoms, low self-esteem, and moderate to high level of stress. And when you look within the sexual abuse, I looked at those that said they had been sexually abused only, and the others that also have physical abuse in addition to the sexual abuse, and the one that had the combined, had more of those conditions. This is also what that data show. When you compare the sexually abused young people with the no abuse, you see that they were more likely to be regular smoker, drinkers, drug within the last year, and also binge or purge or having bulimia. And this was these kids that I mentioned to you through this particular study. And they are being asked when they are youth, so they are very close to whatever happened to them or their behaviors. Now I'm going to show you some other work that I did with my patient. I'm trained as a physician, and when I was seeing my patients in the clinic, they were coming there for routine health care. So they were coming there for physical, or they had a cold, or whatever. And I decided to ask the young people if they had been sexually abused. But the way I asked them is, has anyone ever touched your body when you didn't want them to? Was that your father, your mother, grandparents, your brother, whoever? And was that your breast, your vagina, your buttocks, your penis? I was very direct, very concrete language. There was no, they knew exactly what I was saying. And then from those young people, from my patients, 23% said that they have such a history. And the history went from, touching the breast to penetration, all type of getting pregnant from the perpetrator, all that type of things. Then I asked them, at what age did the abuse start? And this is the age when these kids the abuse started for them. And as you can see, something that happens early in childhood. The mean age was 8.8 years. This is the majority of the kids were pre-menses. So this really, an issue. Then, of the first 100 kids that I'm sharing here with you, 67 of them had one perpetrator, usually over time, but one person abused them, whether it was once or multiple times. 1/3 of the girls, this is all females, actually have multiple perpetrators. And you can see that for these 100 girls, there were 165 perpetrators. Who were the perpetrators? Well, you can see here, the first time, the first person that abused these kids, which is the first column, 31% were the fathers, biological fathers. And when you consider other father figures, like the stepfathers and the mother's boyfriend, the number rose to 53%. But basically, every family member was represented and other relatives. For the girls that had subsequent abusers, in addition to the multiple times, those people are more likely to be other relatives or other people close to the family. The age of the perpetrator ranged from the adolescents to the aged. And when I say adolescent, I don't mean two adolescents making out, because to me that is typical behavior. This would be like a kid who's 17, let's say a boy, having sex with a girl who's 5. And that it was more than 6 years difference. It was obviously perceived as abusive, and it was not just a typical adolescent behavior. So the mean age of the perpetrator was 32. I mentioned to you the mean age of the victims was 8.8. So just imagine the difference in age, 8.8 and 32, the difference in development, the difference in power. These are the same people that are supposed to be taking care of these kids and are adults. Just imagine that situation. 21% of the young people were abused once, but the majority were abused, over time. I'm seeing them when they are teenagers, and some of them were abused, over 10 years, 6 to 10 years, over 10 years, which means that they were abused for a long time, in their short lives. The other thing that they mentioned was that they were also, many of them were abused at least once a week. Some of them were abused daily. So ask yourself, these are teenagers. Some of them have been abused for 6, 10 years or more. Some of them have been abused every week or every day. So when do they have the time to go through the normal growth and development children and adolescents are supposed to go through? Then what I did was that I compared my own patients that were coming to see me, and I compared those that told me they had not been sexually abused with those that had said that they had been sexually abused. And the abused kids had lower trust with their mother, poor communication with their mom, and they had a sense of alienation. They didn't feel connected to their mothers. They also were more likely to run away. They gave a history of running away. So when you see, whether it's in school or in clinics or emergency rooms, that young people come and they're running away, ask why. Try to find out, what are they running away from? This is also just and these are psychometrically tested measures that I use, some of them. And this is just showing that they have lower self-esteem. And this is the same population that I work with. These are kids that life had not been good to them, to many of them, but who said that they had not been abused. So this is comparing the sexually abused with the one from the same background that said they had not been abused. Same thing with depression. Though I found that many of them had a history of suicidality. They had thought about suicide. And about 43% of them had tried to kill themselves. They had tried 1 to 7 times. And this particular group was females, so the way that usually the girls try to kill themselves is by taking pills. So many of them did, but I saw and heard all type of ways that they try to kill themselves. And how can we wonder that they are suicidal when life has been so challenging to them that it's really hard to even contemplate? All the kids, the one that I'm showing to you, were sexually abused. Okay? So in addition to the sexual abuse, some of them, 68% also had physical abuse, 59% had emotional abuse, 28% had other sexual trauma. That would be the date rape, that would be the stranger rape, the person in their building that takes them to the roof or whatever and rape them. So, it's a significant amount of sexual trauma. Of the 25 of the kids, which represent 30% of those that had been in a relationship of their own, they are teenagers, so, some of them have relationships, about 85%. So 30% of those that had relationship already had abusive relationship, like teen dating violence, in terms of like domestic violence type of thing. Much more recently, I am doing research with the human papillomavirus, and I have a cohort, with my colleagues at the Mount Sinai Adolescent Health Center and Einstein and Roswell in Buffalo. So we have this research program that is mainly to look at human papillomavirus and the impact of the vaccine, but we ask a lot of different things. And we are using the child trauma questionnaire measure to assess if young people in this cohort that we are following for like 10 years have a history of trauma, report a history of trauma. And as you can see here, 18% of the girls said they had such a history, and 23% of the boys are reporting such a history. This is over 1,000. This cohort is 1,400 kids. So, it's a big cohort. And this is just childhood sexual trauma, right? So a lot of that, and they also have the physical abuse or emotional abuse or neglect. So they also have those things, but I'm showing you here the sexual trauma. So in addition to the childhood abuse, teenagers also report other type of violence. Some of them, I sort of mentioned them briefly. But the Center for Disease Control and Prevention does this survey in high school, the Youth Risk Behavioral Survey, and they do it in school. So this only represents young people in school, which I also, I think the kids who are not in school may have higher rate. But just to give you a sense, though about 10.6% of the kids that were in school that completed the survey said that they have been forced to do something sexual by someone the last 12 months. And it was higher for females. And it was highest for 10th graders. 10th graders are about 15 years of age. So it's just important to keep that in mind, that at that age they seem to be particularly at risk or vulnerable, I will say, to this type of dating sexual violence. The young people in high school also, as again, 9 to 12th graders, they said that they have been raped. 6.7% said they have been raped over the lifetime. And again, this was higher for girls than for boys. And, the black boys reported that about twice that they were more likely to be raped than whites. This is the last data that is available, that is also 2015. Something else that we are seeing and that we are working with is sex trafficking. And when people hear the word sex trafficking, some people think about people who are being brought into the country, people from Thailand, people from Mexico, and this is domestic sex trafficking. These are our kids, US kids, being trafficked by US people, the demand is US people. So these are our kids, and we really need to come to the realization that sex trafficking is really happening. And the numbers are not known, the true prevalence of sex trafficking in youth. These are children. I'm talking about minors, people less than 18. So nobody really knows the number, and the research is just sort of beginning. And there's a wide range in the different reports as to the prevalence. But some people estimate that it may be as prevalent as 2.4 million children. We don't see the map very well. Not sure what happened to the color of the map. But that was showing that about 88% of the young people who are being sex trafficked in the US say they had been to a doctor when they were being sex trafficked. And they were never identified as sex trafficked because usually people don't think that that's really happening here in our own backyard, so in our own emergency room, in our own clinics. So we don't have that level of suspicion. And so 88% said they had been to the doctor. And the type of doctor, this also doesn't show very well. I'm not sure why it's not projecting that well. But what this shows is that the most common health system where they present is the emergency room. And that makes sense, because if they are being sex trafficked, if they get sick or they think they are pregnant, they have infection or they were beat up or something, they are more, and I'm sure that many of them or most of them or none of them have health insurance. And we know that in our healthcare system, you have to have insurance or money to pay for your healthcare. So they may present to the emergency room, or they have to be served, or they have to be seen. So the emergency room is the most common site where they get seen, but also primary care, clinics, OBGYN, dentists. And again, these young people said that they were not identified. And this work took place here in Mount Sinai. There are wonderful emergency room doctors that are very interested in this topic. And they, both of them did this study here at Sinai. This is just to show you the number, just in terms of proportion or the percentage of people in terms of the doctors. In our own clinic this past year, we saw 223 young people that had a history of domestic sex trafficking. So, we see them, we identify them, or we have partnership with people that serve that population. So we have a major interest in serving those kids. And we have our program. It's a little complex. This is the Mount Sinai Adolescent Health Center. And I just want to talk a little bit about what we offer them and how we work with them. For one thing, I think the staff and the system itself, the clinic, is trauma-informed, right? We know this happened. We had learned that the hard way. Before, when I came to train in 1984, we were not talking about abuse. No one knew that the kids were abused. We were doing physical and checking ears and doing psychotherapy, but we did not know about the really high prevalence of sexual trauma on these kids. And the way that we learned was because some medical students, as you heard, Mount Sinai Medical School was created in 1968, so they came to do a project, and they interviewed young people, young women that were in the waiting room just there for the routine health care. They found out that 58% of them had a history of sexual trauma. So at that time I was in training, but I was at training, but I realized there was something wrong. We spent all this time checking ears of teenagers. If they have infection, it will hurt, they will tell us or something. I mean, we're physicians, so we have to do the physical. But I think the issue was that we were not looking into it. We were not suspicious. We were not identifying. Anyway, so I told my supervisor I wanted to go and review the literature and figure out more about this issue. And then in the mid-'80s, we ended up creating a program for incest survivors and other for rape survivors. And we didn't mix them because we think the dynamics are quite different. So the Mount Sinai Adolescent Health Center and the amazing staff that we have are very trauma-informed. That means that we know this happened, we know about trauma, we know the consequences of trauma. We also are very trauma-responsive. So from our policies and procedures to the way the front desk interact with the kids, to the way we treat them, we really want them to heal. We don't want to re-traumatize them. And then we also use trauma-specific interventions. We could be trauma-focused cognitive behavioral therapy, dialectical behavioral therapy. So we do a lot of that stuff. But above all, regardless of what happened to them, they are teenagers, they are adolescents, they are young people. So we have to meet their needs. And we provide them integrated medical, sexual and reproductive health, dental, optical, and behavioral and mental health services. And we have legal services, we have specialized services for kids who are gay, transgender, questioning, and we just love the kids, and I think they come and we help them heal. And Ken is right behind me, so I'm going to get off the stage. Thank you.